we talking about psychiatric medications in pregnancy? And I'll tell you why I want to talk about it. Number one, it's hard to find good psychiatric care in pregnancy, no matter where you are. I am personally, as a maternal-fetal medicine specialist, I am over having patients being told by any number of healthcare providers that once they get that positive pregnancy test, you need to stop all of your psychiatric medications, as if whatever they were on the medications for is going to magically go away once they're pregnant, or they're no longer in need of treatment. Now, I get that they're thinking about the fetus. That's why they're telling them to stop the medications and the what ifs with the medications. So what I was doing is that, I'm sure you see all the time that, and hear all the time that patients are told as soon as they get that positive pregnancy test to stop whatever medications they're on because of the what ifs for the pregnancy and the fetal effects, and without much consideration for what about the effects of stopping the medications on the pregnant person. So if for someone that's in that boat and is being told early on, before they get a chance to either see their psychiatrist or they're calling to make that initial prenatal visit, what would you recommend those persons doing? I would say, as an MFM, to not just stop everything, but what is the right thing to do in those initial few weeks until you can see someone such as yourself or someone like myself to get the medications squared away?
Well, okay, I feel like this question's a little bit difficult because, you always want to listen to your own. And obviously I don't know everyone's history as well as their own doctor does, but I think even if you're thinking about the fetus, what's best for the fetus, I think it's important to remember that the illness itself is actually more risky for the fetus than most of the medications that we prescribe for mental illnesses. So taking, pretty much most antidepressants that we've studied, we have not found that they're more risky for the fetus or for the pregnancy than the illness itself. And so I would highly recommend that somebody maybe look up resources on really good websites. So not just Google or any website out there, but like womensmentalhealth.org, looking up information on mothertobaby.org. Those are two really great resources that actually give evidence-based information on these medications in pregnancy and seeing, okay, what does this say? Does this say I absolutely should stop this medication, or does this say this needs to be a conversation? And then maybe waiting till you can talk with someone who specializes in this. Also, Postpartum Support International has a psychiatric consult line. So your OB-GYN or your psychiatrist can call the PSI line and say, hey, I want a second opinion, or my patient wants a second opinion on them staying on this medication during the pregnancy. Should they stop it right now? Or, what should be the next steps? And they're great at giving you expert advice from people who are specifically trained in this area.
Yeah, I think it's just good to make the point that there's two patients. You have the fetus and you have the pregnant individual, and you can't sacrifice one for the other. I understand everyone's need and desire to protect the fetus at all costs, but I've seen, as a maternal-fetal medicine specialist, so many times where patient was advised stop everything, and within a few months they're in such a bad situation, which is not good for the pregnancy either. And we will talk about that as well. Untreated mental health disorders, whether it be depression, anxiety, bipolar disorder, anything like that, can have, just as Dr. Lasseter said, a severe consequence on the pregnancy itself and cause adverse pregnancy outcomes. So, I guess probably when you see someone that's in the reproductive age category that may not be considering pregnancy, you have a little bit more leeway as far as what medications you can give them. But if you are someone who's starting to contemplate pregnancy and you are on medications, would you suggest having a conversation then with whoever's prescribing those medications and managing them? Hey, I'm thinking about potentially starting to become pregnant. What should we do now as far as changing up the meds, or are the meds that I'm on okay? When should that conversation occur?
I feel like that conversation should occur when any medication is started, to be honest. And I know that would never happen. But because most, I think, what is it, like 50% of pregnancies are unplanned. So, you know, so most of the time people aren't going to actually have the luxury to plan out, okay, what medication should I be on? What should I not be on? What's better for me or for the baby? So I think whenever you're starting a medication, having that conversation with somebody who is of reproductive age. But yeah, obviously, if you can have it, the sooner, the better. So giving yourself like a year or two to plan ahead of time. Okay, should we try other medications, and then giving those medications ample time to see if they work or not, see if they're going to keep you stable or not is important.
It's important. Yeah, I think, you know, and I think as an MFM, what I want to stop doing is making pregnant individuals feel like or think that they have to stop everything, and if they need to be on the medication, that they're not doing being good for their pregnancy or their fetus, or they're causing harm, because it's with anything. It's not just mental health disorders. It's with anything that we take in pregnancy. It's a risk benefit analysis. You know, giving someone insulin, giving someone medications for seizure disorder. So keeping the stigma on mental health disorders and the medications that are needed to treat mental health disorders in pregnancy, that needs to stop, because it's no different than any other medical condition in pregnancy, and we need to treat it as such. So why do you think there's still such a stigma around medications and those that need treatment during pregnancy for mental health disorders?
Gosh, I wish I knew the answer to that question.
I mean, because you and I, it doesn't make sense to us, but I mean,
Yeah, I mean, I think part of it, you know, it's definitely a cultural thing, but I think, you know, even in our own medical training, I mean, I don't know how it was for you, but for me, like mental health, that training portion of medical school was still kind of, oh, this isn't as important, and this isn't as medical as, you know, treating pancreatitis or, you know, and so I think the brain is just such a complicated organ that people are like, I don't really know much about that, so we're just going to say it's, you know, pseudoscience or whatever, instead of, you know, recognizing we just don't know enough about it yet.
And it has to be treated just like hypertension, diabetes, lupus, anything else in pregnancy. But I also think there's a component too, for certain providers, of liability. Well, if I keep them on this medication and something happens to the fetus, but there's also liability that if you take the patient off the medication and something happens to the patient. So it's not, we can't always put the fetus first. And I know people, sometimes it's hard for them to hear that, but if we don't have a healthy pregnant individual who's making the fetus, we're not going to have a healthy fetus. And if that means being on medications, then that's what it means. And the same thing I would say, when I tell a diabetic, I don't want to put you on insulin because I'm just not sure. So just deal with your diabetes and your high sugars. No, because high sugars are just as toxic to a developing fetus. So there's no difference. So I hope we're making that point across anyone that's listening. It's no different than any other medical condition in pregnancy and needs to be treated as such. So hopefully this will help to destigmatize that a little bit, because I do still feel that it's still there, even amongst healthcare professionals. And